as I said, usually beauty comes from inside out. Beauty to me, it's a combination of your mind, your intelligence, the way you talk, the way you act. It's a whole combination of everything. To me, beauty is just everything.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Damona Emami, owner of Rajunair Concierge Med Spa, holding both an MD and MHA degree. She's dedicated to combining medical expertise with personalized care to enhance natural beauty and confidence. She specializes in advanced laser and aesthetic treatments designed to meet her clients' unique skincare and wellness needs, ensuring exceptional results in a relaxing concierge-style experience. So Dr. Emami, welcome and glad to have you here.
Hi, how are you? I'm so happy and excited to be here.
Yeah, so let's start off with this, Dr. Emami. I'm curious, how did you first get interested in the medical field?
So actually it's coming from my background and my family. So my both parents, they're a physician. My dad is an orthopedic surgeon. My mom is a pediatrician. My brother is a nephrologist. So it just because of the whole background. And then like I grew up in a physician's family.
Mm-hmm.
And then it's funny because like when I turned 18 and I want to decide what I want to do, my parents, they were like, oh, you cannot go to medical field. You need something relaxed. You need to, you can enjoy your life in a medical field is really harsh. It's really not relaxing. Just don't go. Usually the parents force the kids, you need to go to medical field, but they never pushed me. And actually it was my choice.
Okay. So once you got into medicine, how did you end up making that transition to aesthetics?
Okay. So when I finished med school, back home, like I'm Persian, so I finished med school. So my goal was it's totally two different things. So that going to med school, I was hoping for something, and then I changed my direction to another thing. So because my dad was an orthopedic surgeon, the only thing I wanted to do back then, I want to be a surgeon. And not any surgeon, just the orthopedic surgeon. Like I didn't like anything else beside that. So that was my passion back then. So I went to medical school to become an orthopedic surgeon. And then when I finished my school, like some stuff happened in life and I moved to US. So, you must do the exams to just continue your medical education for residency and all of those. And I did the whole thing. And then, so as a foreign grad, so you don't have the luxurious of going to like all they call it luxury specialty, like ortho, ENT, dermatology. The good thing is just I was not interested in those fields, just ortho. So I did a family medicine and then I practiced. And to be honest with you, I was not really I wasn't that passionate about practicing. Sorry to say that specifically in the United States, because nothing about patient care. Maybe I shouldn't say it, but that was my opinion. And then I was like, so the funny thing is back then when I wanted to decide to go to med school, my dad was like always telling me, Damona, you're really good in management. Why you want to go to medicine? Go get your MBA and do the management. I really think you're going to be so good at it. So after that, I was like, oh, I'm really interested in studying master in health administration. And it's kind of, I can combine medicine and management together. So I studied MHA at George Washington University. And then I was like, I really enjoy managing like medical practices. And I shift the whole thing to management. And I wanted to do really something else, and I want to have my own practice to combine. And I always been interested in cosmetic side of the medicine. So I was like, okay, maybe I can combine all of this together. So that was the whole shift
Okay.
for me.
Okay. And so, and you kind of touched on this, but I want to dive a little bit deeper. What caused you to want to start your own practice versus just working at another
I,
clinic?
to be honest with you, I don't like to work for anybody.
There you go. That's the only answer you need. Okay.
Yes.
So then now that you have your practice, what would you say is the most common treatments that your clients come to you for?
Like injectables.
Mm.
Injectables.
Hmm.
Everybody love Botox, the good old-fashioned Botox and filler.
Hmm. Okay. So the injectables is the most common ones then.
Yes.
Okay, got it. And for people who are maybe thinking about getting some type of injectables done, or maybe have never done it before, what's the biggest difference between Botox and filler? Because I think people kind of talk about Botox and filler, but they do two different things. But I think people who have never done it before think like, oh, like they're kind of the same, but kind of not. So, what does Botox do? What does filler do?
So Botox is relax your muscle. So it just when you want to have any injectables like Botox, it's gonna relax your muscle. It doesn't. So a lot of people think when they get Botox, are the wrinkles gonna away? But it's not true. So it's kind of preventive. It's not gonna make your wrinkles go away. It's gonna be prevented for like having more wrinkles. So this
Mm,
is such like a thing that people usually think that, oh, if I get a Botox, the wrinkles gonna away. Yes, it's gonna prevent from future wrinkles because you cannot just have brownies or you cannot make, I mean, like a face expressions. Yeah, I mean, it's gonna be less.
mhm,
And the filler, of course, filler is just like with usually the fillers are HA and also we have PRP. It's gonna, like for example, if you have like a marionette line or like underarm under eye area, they fill it, so it just like, sometimes as you age your collagen, it's gonna come down, everything gonna be less, so you get a hollow part in specific areas. You
mhm.
put filler, HA filler, to prevent aging.
Ah, okay.
That's the whole point.
Okay, so filler really it fills in the empty
Yes.
space, I guess, or like
Or
the hollow
lips,
spaces.
lips, like a lot of places in like a rather certain area in face
Okay,
or yes.
okay. And then what is there a place for combination treatments like doing Botox and filler, or is it really just one or the other?
No, you can do both.
Okay.
They don't interfere. Yes.
Okay. So what would an example be if someone wants to do both? Like they want to use Botox to try and help prevent wrinkles, but they use the filler to kind of fill in the empty spaces. Like,
Yeah, but for example, you cannot do filler in forehead. It just,
mm,
I mean, certain area you cannot put filler,
mm-hmm. Okay.
and certain area you cannot do Botox.
Botox.
So
Okay.
depends. Yes.
Okay. So the Botox is really going to be for these certain areas. You use this. If you want in another area, you do this. And if you want to do full face, you have to use both because it's going to
Both, and
cover.
like some places none of them, so
Okay.
yes.
Okay. Now, what would you say is some of the most common misconceptions about Botox and filler that you hear from your clients or
So
myths?
one of the misconception is they think Botox can like when you have Botox, the wrinkles gonna go away. The wrinkles not gonna go away. It's gonna prevent from future wrinkles. And then with the filler, usually like the only like a downside to the filler is when people put it in, like they want to do more and more, and so their face kind of becomes so inappropriate. So
Mm,
that's one of the things. So you must do it. You see it in like some celebrities, some people in the on the street. You see, so they have like a big lips, like I call it duck lips.
yeah.
It just, they put more and more.
Yeah.
But yeah, if everything is like in a certain way, and like you need to have, so I really like a natural face. So if you put it in a decent amount, everything gonna be like look so natural, but a younger version of you, but
Mm,
very natural.
okay. And so now when it comes to Botox and filler, it's my understanding is that a lot of practices have this. It's kind of like I call it the gateway drug for people. Like they start off with that and they start getting into the other aesthetic treatments. But how do you differentiate from all the other practices out there when all of them do Botox and filler? Like how do you differentiate in a very competitive market?
So I actually have like a custom design plans for each patient. So one of the things that I have is that, and I mix it. Like for example, like a lot of med spas that have like a membership. This is like a tier 1, tier 2, tier 3. I don't have tier 1, tier 2, tier 3, or whatever tier they have. I have a custom for individual. For example, when a patient or client coming to me, it's not just like okay, so you need for example, for one person or one patient, Botox doesn't work, or filler doesn't work, or they need to lose weight and follow a special diet, or like they need certain stuff. So I custom every treatment for each person.
Mm, okay. So it's the
Yes.
customization of really what sets you apart and how you can differentiate.
Yes, and I also combine the medical side of it to it.
Mm,
So if they need like a little bit, so for example, if I do the weight loss treatment for the patient, it's very trendy now. Everybody doing Ozempic and tirzepatide. So when I give them any of those two medications, so I also give them like a IV therapy, because I don't want they lose, or I give them a certain diet to me and my team. I'm a nurse practitioner, not
mm,
specifically me. I'm talking we we gave them the like a more protein in a daily basis, because we don't want them to lose the volume in the face. We gave them we're going to give them the IV therapy so they don't lose minerals and all those multivitamins.
mm. Okay. And then I guess how do you approach the education part of this? Because if someone's coming in for a certain treatment, but maybe kind of as you mentioned, like maybe it's not the right fit for them, or maybe they want this, but they need something else. Like, how do you approach that education part of it to make sure that they're getting really what they want?
So for the first time when they walk into my med spa or my office, we have like a 30 minutes, or like depends, like 30 minutes or more or less. We first talk with them. It's like a consult. We don't do anything. So we give them all the information, all the education they need, and then I let them to decide. I help them. I show them the path. This is, I think, in my opinion, or in my nurse practitioner opinion, this is the right path. You need this, this, this. These are the benefits. These are like pros and cons for this treatment. We prefer you have this, like different person. And then, like for example, we spend 1 hour with some clients, and then eventually it's coming down to them. But we
Mm,
give all the information and education in that consultation, like day, or what, the first day they coming in.
okay. And how often does it happen when someone comes in looking for something, but they leave with something else because of this consult?
It's common. It is
Okay.
common. It
Okay.
is common.
So people shouldn't be surprised if they're looking for something, they come in, they realize they need something else.
Yes, it is
Okay.
common.
Now you mentioned as far as people come in looking for the weight loss, and then you also give them the IV treatments. So that sounds a little bit more on like the wellness side, not as much on the aesthetic side, but wellness. So how important would you say wellness is in what you do, like in the treatments you provide?
So I mix. So it's not just a med spa. That's why one of the differentiation between like in my office to others, it's just like combination of wellness, medical, and cosmetic. So when like a lot of offices, when they just give the weight loss medicine to the patient, have you heard the Ozempic face, right?
Mm-hmm.
So they lose all the volume of their face and their body. So one of the medication, like both GLP-1 and GLP-2 does is like prevent you to eat. So when you eat, you don't intake any multivitamins, protein, or anything like any nutrition. And then so you need to replace that. You don't want to get the Ozempic face. You don't want to be malnutrition. That's why a wellness coming in, and you balance it.
Mm-hmm. Okay. So the wellness is a critical part. If you're looking at
Yeah.
aesthetics, if you're looking at weight loss, the wellness is the other piece of the puzzle.
Yes, it does. It is where it does. It's very important, to be honest
Mm-hmm.
with you. It is very, a lot of people, they don't pay attention to that part, but that part is really important.
Mm, okay. So then what would be the piece of advice you would give to somebody who's looking for a provider who can help them with all this, with the aesthetic side, with the wellness side, and really guide them kind of like you guide your clients? If someone was looking for a provider, what piece of advice would you give to that person on what they should look for when they're doing their search?
So go to the person or office that they really trust, the healthcare provider, and then don't just look at the cosmetic side, because usually beauty comes from inside out.
Mm-hmm.
If okay, so one part of losing weight is people want to be like in shape, people want to be healthy, looking pretty. So it's both uh, medical part and also the cosmetic part of it. So when they want to go to any healthcare provider for anything, they need to consider the wellness, medical, and the benefit of that, the benefit for themselves.
Mm. Okay.
Like combine both.
Okay. So, and are there any red flags people should be aware of when they're doing their search, when they're talking to these providers?
So, like usually, like for example, I give you a like an example for a filler. So, HA
Mhm.
filler, everybody want to do filler for the lips, the teardrop area. So, when you go to the provider, so I usually don't give any of my clients teardrop, like a HA teardrop uh, filler, because it's not good. Usually
Mhm.
PRP better. PRP is from your own blood. Also, it produces more collagen to your body. So if you go to somebody that it just say, oh, you need this, without giving you any evidence, for example, you need a filler for your face, without any evidence or why you need that, just don't not trust, but don't, just do more research.
Okay. So just going on Google, doing a little bit of research will.
No, don't trust Dr. Google. I
Okay.
hate that.
So then what should they do as far as research goes? That's another good point. Like for the average person, like where do they
I
go?
mean, actually, you can research on Google, but don't trust it. I call it Dr. Google. I don't like it. People coming to you and then Google tell them,
Yeah.
okay, this, and it's totally wrong.
Mm-hmm.
Talk with, like, go to the few other providers, talk to other people that they done that. There are few resources, other people, other providers. Also, Google, like magazines, everything, like the combination of everything.
Mm-hmm. Okay. Good to know then. Now, I want to switch tracks to Mona. I want to go over to kind of how you approach your patient care, your client care. How important do you think having an artistic eye is in what you do?
It is very important. It's very important. Artistic eye. So that is the cosmetic side. You need to know. So you need to know that the client that's coming to you needs that procedure or not. Don't just for the sake of the selling something, or just for the sake of selling something and have money. Don't recommend something to your patient.
Mm-hmm.
You really need to have that eye. So okay, you need that.
Mm. Okay. So you need to have that eye to really figure out, can you get them the end result they're looking for?
Yes.
Okay. Now, Damona, I'm sure that you've had some challenging cases over the years, or maybe memorable ones. Is there maybe a story that you can share that is just a memorable case or a challenging case, and how you were able to get them a great outcome in the end?
To be honest with you, I didn't have a challenging case.
No. Okay. Is there a
Yeah.
memorable one then? One that stands out in your mind?
Like in a cosmetic area, I didn't have.
Mm-hmm.
Like for the from my office med spa, I don't have like anything ooh stands out or very like exciting.
Mm-hmm.
It just like routine procedures and routine, like a person coming in for this treatment,
Mm-hmm.
that treatment. It's not nothing very special that is
Mm-hmm.
so like is very like stands out.
Mm-hmm.
It's a, but I don't. In a cosmetic side, I don't have anything.
Okay. So everyone's been, it's always been a smooth sailing.
Yes,
Okay.
yes,
Well, at least that's good. There's something to be said about that.
yeah.
Now, where do you think the future of aesthetics is going?
Actually, I think like a lot of more devices, laser treatment, rejuvenation, uh, like a treatment coming out, because I think as we, the technology is advancing. I think a lot of uh, like a lot of rejuvenation procedures is cosmetic. Like I
Mhm.
mean, it's a plastic surgery. So I think in few years, like for example, you want to do tummy tuck, so you need to go to the plastic surgeon. You want to do the like a breast augmentation, you go to the plastic surgeon. I think in like few years, maybe 5, 10, a lot of like devices, a lot of stuff is coming out. That is my opinion, that
Mhm.
you don't need that invasive treatment, like going under the surgery. I think you can do it like with a like a simple procedure, like a laser.
Mhm. Okay. So you think the future is going to be more non-invasive, but still being able to get even better and
Non-invasive.
better results.
Yes.
Okay. And for your practice, Rajunir Concierge, what's your vision for your practice?
Uh, I really want to expand it. I really want to have multiple location expanded, and I want to bring in more um, healthcare providers in and be partnered with other people,
Mhm.
other doctors.
Okay. So it's growing the practice
Yes,
and helping more people.
helping more people, like medical side and cosmetic side, because I combine both. I
Mm.
just don't do cosmetic.
Okay, got it. Well, Damona, I have one last question for you, but before I ask it, I do want to point people to your website at rajunirconciergemd.com.
Yes.
Now, last question for you is what does beauty mean to you?
As I said, usually beauty comes from inside out. Beauty to me is a combination of your mind, your intelligence, the way you talk, the way you act. It's a whole combination of everything. To me, beauty is just everything.
Okay. Well, there you have it.
Education, everything,
Yeah.
everything.
Okay. Well, there you have
It's
it.
not
Yeah.
necessary the pretty face.
Okay. Got it. Well, Damona, thank you for sharing your expertise. So,
Thank
where can
you.
people contact you in your practice?
So they can visit at my website www.rajuneconciergemd.com, and also my phone office phone is 407-499-0399, and I have an Instagram like Rajune Concierge MD too. They can like reach out to me with that too.
Awesome. Well, Damona, this was great. Thanks for coming on and thank you for sharing your message.
Thank you. It was an honor to talk to you and your team.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.